So what we're going to do today is talk a little bit about genetic testing and what we're looking at and disorders that we're looking at and the picture products. So to introduce picture genetics a little bit, obviously when anybody is planning a pregnancy, we're always planning a pregnancy, then there's pregnancy, delivery, newborn, and childhood. And every parent wants the same thing, which is a healthy baby, good information, and the best medical care. So Picture has two products. We have Picture Parenting, which is carrier screening, and that fits before or during pregnancy, and Picture Newborn, which is newborn genetic testing that fits after birth. And both of these are at-home clinical grade genetic testing paired with certified genetic counselor guidance. So any results, you can follow up with one of our genetic counseling partners. Straightforward, easy to understand results you can act on. An analysis for Picture Genetics is performed at Fulgent Genetics, which is a CLIA certified CAP accredited diagnostic lab working with physicians from 700 plus institutions worldwide. So it's very confusing with pregnancy, and it really is a journey. And there's so many different types of genetic testing and screening that really it gets super confusing. So before and during pregnancy, the first step is carrier screening. And that's going to look to see if you and your partner of carriers of certain genetic conditions, can you pass down an inherited condition? And then for some people, their journey will then take them to in vitro fertilization with embryo testing, which you can then do some genetic testing on the embryo and decide which are the healthiest to transfer. During pregnancy, that is when we do non-invasive prenatal testing or screening. And this is screening for certain genetic disorders in pregnancy. Now, screening never says yes or no. It says whether your chance is higher or lower to really establish whether diagnostic testing would be indicated. So it's really important to always note that screening is not definitive. It really is to assess risk. After your baby is born, then there's state newborn screening. And newborn screening looks for specific genetic conditions. And that's all babies get, that heel prick at birth. Or right after birth, I would say. And then after birth, there's Picture Newborn. Does my baby have an early onset condition that could benefit from early treatment beyond state newborn screening? And then during the pregnancy, there is also the option for invasive diagnostic testing. And this is testing that is going to be diagnostic for whatever genetic condition is being tested for. So there's two options. One is CVS, which stands for chorionic villus sampling. And that's when we take a tiny sample of the placenta to confirm a diagnosis. And this is at 11 to 13 weeks of pregnancy. And the other one is an amniocentesis. And that's where we take fluid out from around the baby. And just like we get rid of our skin cells in the shower, the baby gets rid of its skin cells, the amniotic fluid, and we grab the fluid, and in those cells we can look at genetic changes in the baby. And this is done at 15 weeks or later, generally between 15 and 20 weeks of pregnancy, which is also diagnostic. The pros to both of these is that you get definitive answers. The negative is there is a small risk for miscarriage with the diagnostic tests, whereas screening has no risk. So what is genetic carrier testing? This is always really confusing for everybody. And when you think about it, we have everything we have half from mom and we have half from dad. So your baby gets half of everything for each of you. And on the chromosomes are genes, and genes are what decide everything about us: hair color, eye color, everything. So think of it like a recipe book. Your DNA is like a recipe book with 20,000 genes, 20,000 recipes. Each recipe tells your body how to build one thing, whether it be a protein, an enzyme, a structure, and you inherit one copy of each recipe from your mom and one copy from your dad. So your baby will inherit one from each of you. And humans have 23 pairs of chromosomes. As I said, one whole set from mom and one whole set from dad. What does it mean to be a carrier? So for different genetic conditions, there's different what we call inheritance patterns. Since we have two genes for everything, if something is called dominant, you only have to have one of the genes changed for there to be an issue. An example would be a skeletal issue such as achondroplasia. Most of the carrier screening we do is for recessive conditions, and that is where mom and dad would both have to be carriers. carriers. And if they're both carriers, there's a 25% chance in any pregnancy to have an affected baby. So if you remember back to high school, Mendel and his P's. So common examples of these types of disorders are cystic fibrosis, sickle cell disease, and spinal muscular atrophy, commonly referred to as SMA. So most people that have no idea that they're a carrier of a genetic condition. So, a lot of times what happens is we take a family history. You don't have a family history, so you think, I can't be a carrier. But with recessive conditions, unless two carriers happen to have an affected baby, you could be a carrier generations and generations back, and you would never know. So what commonly happens in families is maybe a mom who is pregnant or about to get pregnant gets carrier screening, finds out she's a carrier of something, and then she goes to her parents and they both say, I'm not a carrier of that. And one of them is a carrier. They just never knew because this testing was not done at that time. Over 70% of people carry a recessive genetic condition. So the more testing we do, the more we find. And 80% of children with a genetic condition have no family history. And the reason that can be is either it can be new in the baby, which we call de novo, or it can be just by chance, two carriers never happen to have an affected baby. It's not always invisible. So we used to tell people if you were a carrier that had no implications for your health, but it was only for the baby. But there are certain genetic conditions that we do now know that being a carrier can sometimes affect your mom's health as well, or dad. So those are called manifesting carriers. So who should consider picture parenting? Anyone who's pregnant or planning to be pregnant. So preconception couples, the ideal time is before you get pregnant because results can guide your family planning before a pregnancy begins. Any ethnic background. There's different carrier rates for different disorders dependent on your ethnicity. IVF or fertility patients, results can guide which embryos are used during IVF through genetic testing of the embryos. First trimester patients, early results still leave time to explore your options and prepare for any outcome. And no family history is needed. You don't need a relative with a genetic disease. Most carriers have no family history of that condition. Have you been tested before? So this is something important to note. Picture parenting covers 30 conditions that are relatively common across different populations and ethnicities. Sometimes you might have a test like Picture, and then during your pregnancy, your obstetrician might offer further carrier screening. And to note, there are different panels, and there are panels that have more than 30 conditions. So don't necessarily assume that tested for Picture, you've been tested for all of the genetic conditions. That is a conversation to have with your OB at that time. Here's some key carrier conditions, what they are and why they matter. Cystic fibrosis is one of the most common affected conditions in Caucasians, okay? 1 in 25 people of European descent are carriers of cystic fibrosis. So if you would look around in a room of 30 people, at least one person there is probably a carrier. But they probably don't know it because unless someone in their family was also a carrier and they had an affected baby, you wouldn't know. 1 in 46 people of Hispanic descent are cystic fibrosis carriers, and 1 in 65 of African American descent. And what is CF? Well, it mainly affects the lungs and digestion, and there is a gene that does not work properly, the CFTR. This makes mucus thick, and that can make it harder to breathe. Kids will need treatment to stay healthy and grow well. So all kids born with cystic fibrosis will need daily treatment. And this is managed with daily care and medicines that keep kids healthier. Care has improved so much that people are living far longer today than they used to with cystic fibrosis. New medicines are dramatically improving everyday life for many families. So if both people are a carrier of cystic fibrosis, there is a 1 in 4 chance of passing that on and the baby being affected by having both changes. And the treatment window, you want to know in the newborn period so you can start care as soon as possible. On the right is the cystic fibrosis, and on the outside, children with cystic fibrosis are not any physically different. All of the processes are really mostly affecting their lungs and digestive systems. Whereas SMA, spinal muscular atrophy, which 1 in 40 to 60 people are a carrier, and that is not dependent on ethnic background, affects muscle strength. So those babies are born and their muscles start to atrophy, and they usually would die by the age of 2. But it's really an amazing success story because it's one of the first genetic disorders with gene therapy. So now if you know that your baby is going to be affected, then you can do testing right after birth gene therapy. And thus far, we're a few years in, it seems that they are not having any of the SMA symptoms. So it's really amazing. A different type of carrier condition is an X-linked condition. So X-linked, women, we have two X's, boys have an X and a Y. So Fragile X is what's called an X-linked condition because a woman can be a carrier and her sons would be much more likely to be affected than her daughters. About 1 in 250 women are carriers. The most common inherited cause of learning and developmental difference is Fragile X. It makes up about 4% of all autism. And this testing in picture parenting would tell you if you're a carrier, and testing shows the chance of passing it on. On the right, you see 3 different boys with Fragile X syndrome. The physical differences are subtle. It really is just looking compared to their siblings. They might have ears that are a little bit larger and stick out. They might have what's called the long philtrum, where this part is longer, and a thinner upper lip. Another classic example of a genetic disorder is Tay-Sachs disease. And about 1 in 30 people of Ashkenazi Jewish descent, or French Canadian or Cajun heritage, is a carrier of this disorder. And knowing early gives families time to plan and explore options. And sickle cell disease is really one of the most common. About 1 in 13 African Americans are a carrier. It's also common in Hispanic, Mediterranean, and Middle Eastern families. And so this is something that, with being such a melting pot, even when we're talking about being a carrier, being ethnicity specific, really anybody can be a carrier of any disorder. And early care helps prevent complications. So if you're both carriers, what are your options? You can continue natural conception with awareness of the 25% risk per pregnancy. Parents prepare for any outcome rather than avoid the risk. You can have prenatal diagnosis that we discussed, CBS or amnio. So if you're already pregnant, these tests confirm whether the current baby is affected and can inform medical planning. You can have IVF with embryo testing, which is called PGT, pre-implantation genetic testing. And embryos are checked before pregnancy begins, so only unaffected embryos are then used to conceive the pregnancy. You can use a donor egg or a donor sperm. Using a donor who is not a carrier eliminates that risk, and this is widely available for fertility clinics. And genetic counseling. A certified genetic counselor, such as myself, can walk you through all of these options without judgment. All picture tests include access to a genetic counselor. So picture parenting focuses on pan-ethnic carrier screening, which means carrier screening of disorders across different ethnicities. It looks at 30 commonly inherited conditions before or during pregnancy, and it supports informed family planning. Once you're pregnant, now we move into different testing. The main test that people know about is the NIPT, which is non-invasive prenatal testing. And really, this is something that sometimes people call the gender test because that is one thing it can tell you. So during pregnancy, tiny pieces of your baby's DNA travel through the placenta into mom's blood. And this is all normal. And this simple blood test on mom reads these pieces to screen for the chance of certain genetic conditions. The classic example is Down syndrome. So whenever you are screened for Down syndrome in pregnancy, you will be having NIPT. This is no risk to the pregnancy because it's just on mom's blood. But again, it is only a screening test. It is not 100%. When is this done? Generally at 10 plus weeks of pregnancy. And what does it screen for? So there's chromosome conditions such as Down syndrome, Edwards syndrome, which is also called trisomy 18, and Patau syndrome, which is trisomy 13. Plus, we can look and see if the baby is a boy, okay, or a girl. If you'd like to know, some tests screen for 50 plus conditions. So different NIPTs have different amounts of conditions that they screen for. So it is also something that you can speak to your obstetrician about. Why is this important? It provides early information about your baby's risk, and it's non-invasive, posing no risk to the pregnancy. Once the pregnancy is complete and you have your amazing bundle of joy in your arms, that's when we talk about the Picture Newborn panel. There's newborn screening in every state. And in all different states, it depends on the state as to how many conditions are screened for on the heel prick. And again, it's important to note that it's screening, that even if you get a call from the state or from your pediatrician, they still have to do diagnostic testing. This is performed in the hospital shortly after birth. It includes the heel prick, hearing test for hearing, and pulse oximetry for oxygen levels, and may require follow-up testing. Picture Newborn adds more to this. It's elective and it's a complement to standard screening, a gentle cheek swab sample collected at home. And it looks at 200 plus rare conditions, often manageable or treatable when caught early. It's run at a certified high quality lab using genetic analysis and provides diagnostic results and access to a licensed genetic counselor. Early detection may aid in treatment of specific genetic conditions. So again, 1 in 25 people test positive to be at least a carrier of a genetic condition. On Picture Newborn, there's 200 plus conditions covered beyond the standard state screening, and the turnaround time is about 2 to 3 weeks. If a newborn receives a positive result from Picture, we'll connect you right away with our genetic counselor. So what conditions do we look for with Picture Newborn? Well, there's conditions that affect all different organ systems. When you have a metabolic disorder, that is a gene change that stops the body from properly processing food into energy or breaking down toxic byproducts. There's blood disorders that can control bleeding. There's hearing loss, cardiac conditions, immunodeficiency conditions, which affect your immune system and your ability to fight infections, pediatric cancers, epilepsy, which is seizures, vision loss, and other conditions. To give an example of a condition on Picture Newborn is called PKU. Okay, and PKU is a classic condition that's also on newborn screening because it really can change medical management. So when a baby is affected with PKU, the body can't fully use part of the protein in food. Babies look and feel completely healthy at birth. There's no visible signs early on. And this is one of the most commonly newborn screened conditions. Newborn screening catches it on the first day. The state heel prick and Picture Newborn cheek swab both check for it. If it's found early, it's very manageable through dietary changes. If it's caught at birth, a special diet keeps development on track. Babies who start early grow up healthy and thrive, and treatment window is important to begin right after birth. No procedures or surgery, just the right nutrition. And this special diet continues through life with excellent outcomes. This is exactly why every newborn is screened. Other newborn conditions to know about, there's SCID, which is an immunodeficiency condition. It's also been referred to as bubble boy condition. And babies are born without a working immune system. Caught early, a transplant in the first weeks can be curative. There are disorders such as Krabbe's disease, and this affects the protective coating around the nerves. Treatment before symptoms appear can change the course. Timing is critical. Pompe's disease affects muscle and heart. The body's structure struggles to break down stored sugar, which affects the muscles and heart. Enzyme treatment starts early, prevents most damage. And then there is disorders of feeding and digestion, for example, galactosemia. The body can't process the sugar found in milk. A simple formula change in the first days of life prevents serious problems. When we talk about the conditions on Picture Newborn, there's conditions that affect their metabolic disorders, there are blood disorders, there are hearing loss disorders and cardiac conditions and immunodeficiency disorders. There's pediatric cancers that would be treated once detected, epilepsy, vision loss, and other conditions. So really the next step starts today. Add Picture Parenting or Picture Newborn to your care plan. No doctor's visits or insurance are required. There is a 30% off webinar attendee promo code that is on the slide. And how you would get started, you would go and order a Picture genetic kit. You would activate your kit. You collect sample and mail it back, a simple saliva sample or cheek swab, and you receive results and schedule a consultation, reviewing with a genetic counselor. And this makes results clear and actionable. If you have any questions, you can come chat with us in our booth July 8th to 10th. You can always visit picturegenetics.com. Finally, just speaking of how this helps You have picture parenting for carrier screening that helps you at the beginning of your journey, either before you're pregnant or earlier in pregnancy, to see if babies are going to be affected with specific genetic conditions, 30 conditions. And then after birth, you have picture newborn, which tests some of those same conditions, but also other conditions that are not tested for by carrier screening, not tested for during the pregnancy, not tested for on newborn screening, and can only be tested for with a panel of genetic tests.